We want to be able to feel like we can go to somebody, go to a doctor, have them get you and get as much about your experience in truth.
Siobhan Stewart is a thriving working woman in her 30s, but it's been a years-long journey to get to this point. She noticed in her early 20s that something wasn't right during her first year of undergrad.
I remember my energy level just felt like diminished, and my circumstances at the time made it difficult to take a leave or take a break because of the scholarship that I had.
It would be a few years later before she would be initially diagnosed with anxiety and depression. Turns out that those were actually symptoms linked to ADHD, which she wasn't officially diagnosed with until her 30s.
This was after calling 5 different offices who, she saw me and she was willing to do the diagnosis, and she did it cheaper than what she normally would do it as because she understood that I was inside of the gap.
Trying to get the right help on time is just one experience Black women and girls deal with. Trying to navigate the healthcare system is a whole other mountain to climb. Kiri Daniel founded the Black Women's Institute for Health to provide resources in order to help bridge that gap.
If you're not being taken seriously and you know to your core that something is wrong, you keep that persistence. You have to be persistent. You have to insist. You have to go back, ask questions, bring someone with you who can ask those questions, and just make sure that you are self-advocating.
Daniel says sadly a lot of experiences for Black communities as a whole has been anecdotal. Now, how does one compare results of lived experiences for Black women and girls navigating the healthcare system now compared to 5, 10, or even 20 years ago? Well, you can't, and that's the problem. There's currently not a lot of Canadian data. In fact, the data that healthcare providers rely on for lived experiences for Black women and girls in this country is actually collected internationally.
We do not have overarching data that tells us about our experiences across the country, and that's what this survey is. This is the first time ever in the history of this country, if you can believe that we are going to be collecting data in such a comprehensive way.
The survey that Daniel is talking about is called Voices Unheard, a national survey collecting experiences of Black women and girls getting health care in the country.
The reality is the system is not neutral. It does not treat everyone the same.
The survey is up online until December 30th. The goal is to eventually form a national task force where the survey can help lead to better informed policies so that someone like Siobhan can be heard and thrive.
I want to be able to trust that when I do need care, I can lean in and be supported.
Afua Baah, City News.